Chapter 21, Blood Vessels and Circulation, page 1. Arteries carry blood away from the heart. Arterioles are the smallest branches of arteries. Capillaries are the smallest vessels, and capillaries are the site of gas exchange. Venules are the smallest branches of veins. Veins carry blood toward the heart. Vessel wall structure. The tunica intima is the inner endothelial layer plus connective tissue. The tunica media is the middle muscular layer with connective tissue. The tunica media controls vessel diameter. The tunica externa is the outermost connective tissue layer that provides support. Arteries have thicker walls and more smooth muscle. Arteries expand under high pressure, and the term for this is low capacitance. Types of arteries. Elastic arteries. These are the biggest and the nearest to the heart. An increase in the transport of blood volume leads to an increase in the diameter. There are lots of elastic fibers in elastic arteries, and this makes it more resilient so that it tolerates pressure changes. Muscular arteries. Muscular arteries contain a lot of smooth muscle, and they change diameter. Muscular arteries deliver blood to muscles and organs. Page 2. Arterioles. Arterioles regulate blood pressure and blood flow. They contain a lot of smooth muscle, they change diameter, and they are smaller in diameter than muscular arteries. They deliver blood to tissues. In arterioles, the tunica externa is severely reduced. Capillary detail. Capillaries are endothelial tubes plus basal lamina. Capillaries contain no tunica media nor tunica externa. They are the smallest in diameter, and this permits gas and nutrient exchange. Types of capillaries. Continuous capillaries. These are complete endothelial lining. They permit small solute and water diffusion. They prevent cell and protein movement. Fenestrated capillary. These are found in endocrine organs as well as the choroid plexus, the kidneys, and intestines. A fenestrated capillary is a porous endothelial lining. Fenestrated capillaries permit larger solute, water, and small peptide diffusion. Capillary anatomy. Thoroughfare. A thoroughfare is a typical capillary bed. Metarterial region. This region contains lots of smooth muscles with precapillary sphincters to control flow. Anastomosis. Arterial anastomosis. These are two arteries that feed a capillary bed. Collateral arteries are often present, just in case something gets clogged. There are many of these within the heart. Arteriovenous anastomosis. This is the connection between an arteriole and a venule. They bypass the capillary bed. They typically utilize the oxygenated blood that goes through them. Vein detail. Veins have thinner walls and less smooth muscle. They expand under low pressure, meaning that they have increased capacitance. Page 3. Types of veins. Venules. Venules are the smallest diameter of veins. Venules lack a tunica media. They have valves to permit only a one-way flow. Medium-sized veins. In medium-sized veins, a thin tunica media is present and a tunica externa with quite a bit of elastic and collagen fibers. Medium-sized veins also have valves to permit only a one-way flow. Large veins. Large veins are the largest diameter of vein. They contain a thin tunica media as well as a tunica externa with lots of elastic and collagen fibers. Blood flow. Blood flow is attained by muscular contractions and the respiratory pump. It is based on many factors. Blood pressure. Increased pressure will lead to increased flow, and decreased pressure will lead to a decrease of flow. Vessel resistance. Greater resistance will lead to lower flow. Lower resistance will lead to greater flow. Vessel resistance is dependent on multiple factors. The next 4 points pertain to vessel resistance. Vessel diameter. An increase in vessel diameter will lead to a decrease in resistance. A decrease in diameter will lead to an increase in resistance. Vessel diameter is based on smooth muscle contraction and relaxation. Vessel length. An increase in length will lead to an increase in resistance. A decrease in length will lead to a decrease in resistance. Vessel length does not change appreciably. Blood viscosity. Blood viscosity is based on suspended materials. An increase in viscosity will lead to an increase in resistance, whereas a decrease in viscosity will lead to a decrease in resistance. The fourth factor affecting vessel resistance is blood turbulence. Blood turbulence is the swirling of blood. An increase in turbulence will lead to an increase in resistance. A decrease in turbulence will lead to a decrease in resistance. Cardiovascular pressures. Arterial blood pressure. This is pressure exerted upon vessel walls. Page 4. Systolic pressure. This is the max blood pressure at ventricular systole. Typically in a healthy male, this number will be 120. Diastolic pressure. Diastolic pressure is the minimum blood pressure at ventricular diastole. In a healthy male, this is typically 80. Pulse pressure. The pulse pressure is the difference between systolic pressure and diastolic pressure. So if the blood pressure was 120 over 80, you would take 120 and subtract 80 to have a pulse pressure of 40. Mean arterial pressure, MAP. This is the average blood pressure. MAP equals diastolic pressure plus 1/3 of the pulse pressure. So therefore, if we're using the example from above and we have a pulse pressure of 40, we would take 40 divided by 3 and add 80 to that. This would give us a mean arterial pressure of 93. Venous pressure. A decrease in venous pressure will lead to a decrease in flow. and this is very problematic. An increase in venous pressure will lead to an increase in flow. Venous return is helped by many factors. The three factors that Dr. McCann gives us are skeletal muscle contractions, and under this contractions push blood through veins, and then valves. Valves provide one-way movement. Valves compartmentalize blood. And the third factor he gives us is the respiratory pump, which is thoracic activity. Movement of the thoracic cavity helps move blood. Capillary pressures. Capillary pressures affect capillary exchange. The three types of capillary pressures are net hydrostatic pressure, net colloid osmotic pressure, and net filtration pressure. Net hydrostatic pressure, NHP, is moving out. It pushes water and solutes from the blood out to the interstitial fluid. Net colloid osmotic pressure pulls water and solutes from the interstitial fluid back into the blood. Net filtration pressure is the net hydrostatic pressure minus the net colloid osmotic pressure. If the net filtration pressure is positive, then fluid and solutes move from blood to interstitial fluid. This is called filtration. If net filtration pressure is negative, then fluid and solutes move from the interstitial fluid back into the blood, and this is called reabsorption. Cardiovascular regulation, autoregulation. Local factors change blood flow to one capillary bed. This is autoregulation. Under autoregulation, local vasodilators. Examples of this are increases in carbon dioxide, increases in free hydrogen ions, increases of temperature, or decreases in oxygen. These will lead to an increase of blood flow by dilating precapillary sphincters. Page 5. Also under autoregulation are local vasoconstrictors. Examples would include an increase in prostaglandins, and this would lead to a decreased blood flow to repair damaged tissues. Neural regulation. Centers in the medulla receive chemical and pressure information and adjust vascular resistance accordingly. Vasomotor tone. With respect to vasomotor tone, sympathetic nerves are chronically active, so arterioles are always partially constricted. This could be thought of as background buzz. The arterioles are always partially constricted so that it can vasodilate or vasoconstrict. Exercise effects. Light exercise. Light exercise will lead to an increased heart rate, cardiac output, venous return, and vasodilation. Heavy exercise will lead to decreased blood flow to non-essential organs. With respect to health and disease, increased training will lead to an increase in stroke volume and a decrease in heart rate, blood pressure, and cholesterol.